Hi everyone, thank you so much for joining us today for our CoFIT-20 series. My name is Kristy. I will be talking to you a little bit today about nerves. I'm one of the newer family members here at Robbins Rehabilitation East. I work out of our Phillipsburg office. I've been practicing physical therapy for about 15 years and with Robbins since November. So I'm sorry that we couldn't get this done live, unfortunately. But I have three little guys that run around. They're quite loud. You might hear them, or maybe one of them is desperately trying to make an appearance. But this should go a little bit more smoothly if they're elsewhere. So today what I thought we would talk about are nerves. If you've been to one of our practices or had PT in the past, chances are that you've done some type of nerve gliding or flossing, something to keep them healthy and safe, especially after an injury. Nerves account for about 3% of our whole body weight, which is kind of a lot considering most of them are very, very small. We do have some that are quite large, like the sciatic nerve, probably the most popular. It's probably about the size of this loop. Our median nerve, ulnar nerve, they tend to be a little bit larger, so maybe half the size of this TheraBand loop. Together, they have 46 miles approximately of nervous system tracking in our body, and they change very, very slowly, but they're always adapting, always changing, trying to read our body and allow us to move and function the way that we need to function. So what I wanted to demonstrate first was how a nerve actually kind of moves. It's a little bit hard to visualize if you haven't seen it before. What I'll show you is with our loop here. So if we're talking about what we call the median nerve, you might have heard of it with regards to carpal tunnel. It's about half the size of this guy again. All our nerves start from the spine. If we touch it around our middle finger and stretch out my arm, you can see how it pulls and the band starts to stretch. And all along that pathway, there's places where it can get caught. If you've had an injury, anything like a golfer's elbow, carpal tunnel syndrome again, or even a shoulder injury, this nerve comes right down through the shoulder. So a happy, healthy shoulder, something that moves, you have a lot of strength there, would be beneficial to keeping the nerve functioning properly at the wrist. If you're stuck here, chances are you're going to get a little bit more wear and tear at the wrist, and you might not really think about the shoulder being involved because your symptoms would be at the wrist. So in a little bit, we'll go over some ways that we can start to move that nerve. So that was the median nerve. We have two other big guys coming from, coming into our upper extremities. The second is the ulnar nerve. If we take this band, the ulnar nerve, also kind of more commonly known as the funny bone nerve, comes right through here, and it gets more of a stretch when we're bending our arm. So if you sleep with your arm in a bent position for a long time and it goes numb or tingly, chances are that you've been something like this, and it was just too much for the nerve and you start to get symptoms. Or if you bang that guy right here, you're going to get those tingling pins and needles all the way to your pinky, maybe part of your ring finger as well. Last, we've got what we call the radial nerves. We're going to take this guy, wrap it around. The band's a little bit longer than it needs to be, but I can't cut this one. Here. So when we reach, you can see how that band is stretching. So sometimes people will complain of pain, maybe at their wrist, their elbow, maybe even the shoulder. When they're reaching for something, opening a drawer, seat belts, even dressing, shirts are another thing. If there's irritation along this nerve pathway. So let's get into it just a little bit. Okay, so as we go on through some of the exercises, I'll show you a few exercises that might be a little more gentle for your body, and some that might be a little bit more stronger. Everybody is created different. We're all asymmetrical, which is okay. It doesn't mean that there's an injury or a problem. You might find that if you do one side, you might be a little bit more tight than the other side, and typically it's the dominant side that's a little bit more tight. We use it more, the muscles are a little bit more tight. Also, sometimes body mass has a little bit to do with it. If you have more muscle tension built up in those tissues, you might not be able to get full range as well. Also, the history of injury. If you have any repetitive overuse injuries, that might influence how you're feeling things. There's could be a little bit of scar tissue, in which case these would be great exercises for you to do. If you watched some of our other CoFIT series, we're home, we're doing maybe some more housework. There might be a little bit more repetitive nature to some of the things that we're doing. Maybe you're painting, doing lots of hammering, a lot of bending because it's gardening season. These are all exercises to maybe help keep that nervous system moving a little bit better and keep you from getting a little bit less, or keep you a little bit less sore. So first, we're going to talk about the median nerve. So that's the big one, most commonly associated with carpal tunnel syndrome. It goes right through this space here, so it gets to be a little bit tense, and we want to make sure that's nice and stretched out. But first, kind of a more simple movement. Unfortunately, I don't have a balloon because the kids popped them, but if you take a balloon or a ball and you just hit it back and forth, that opens and closes this wrist area so you can get a nice little stretch. That's a nice easy movement, something you can do even if you're just sitting at a desk and needed a little break to toss something back and forth. That's probably a little bit easy for most people, but it is a way to get moving. Next, what you could do a little bit harder, you could pretend you're pushing something away. Just like this, like push, 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 and you're going to get a nice little stretch. You might feel it up into your arm, so maybe not even down in your wrist. And extend, so bring that wrist backwards, and that's going to get you more stretch. Now, one of the more difficult moves, actually, I guess we'll get to that one in a second. There is one more move that I kind of like the best, but if you put your hands together and you push all the way to the side, you'll feel a nice little stretch. Same thing to the other side. This is where you might notice a difference in how your sides feel compared to each other. Over and over. Now, this one is a little easy to cheat. I almost did it myself. But when you're pushing over, you don't want to twist your body. You want to keep your body midline, kind of centered, and just make your arms go. Yeah. And if it hurts out here, back off. As with anything, if you get any pain or you start to get tingling, back off just a little bit. It should calm down relatively quickly, but you don't want to push into it. We have a ton of variations that we can do for everybody. Depends on what your symptoms are, if you are symptomatic at all, but these are good to do whether or not you have symptoms. We are medical professionals that can help you with this. So if you do have a question as to whether or not one of these exercises would be good or would not be good for you, don't hesitate to let us know or contact your medical provider. But we definitely have lots of experience with this, so we can help you. So again, this side to side, just a nice gentle movement. You can really feel it in the elbow as well. And then again, maybe you're more tight in the shoulder and you might feel it there. Okay. And last, what we're going to do, kind of similar to when I showed you before with the rubber bands. If you're just sitting up nice and tall, you want to lower your shoulder down, arm out to the side, keep your elbows straight, and you're going to bend your wrist. You're going to pull, back, 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 and then release. So down with your wrist, really push, hold it for a few seconds, and then back off. You may only want to do 10 or so of these guys. More is not always necessarily better per se, but if you do too many, you can start to irritate the nerve and it might not feel great for a little bit. Now when you're doing this, you want to keep your shoulder down, elbow straight, and bend your wrist. If you're just doing this and you're not feeling a whole lot of resistance, try to push that wrist a little bit further. Make sure your elbow's down. Because if you elevate that shoulder, it takes pressure off the nerve here. And then you can probably you might go a lot further with the hands, but you're not getting a great stretch. That's probably one of the better exercises for carpal tunnel. So if you are sitting, doing a lot more work from home, or helping kids with their schoolwork and doing a lot more typing and answering emails, that might be one for you to do. And you can do both at the same time. If you do, again, find that this is easy, if you just switch and move your neck to the left or to the opposite side, you should feel more stretch because all of those nerves come from the spine. So imagine pulling that string over to the side and then back off. Okay. Part 2 is the one we probably get the most looks from. It's funny to do in the clinic, kind of funny to demonstrate. Typically it's called Birdman, but if you're going to take your hands, this is for your ulnar nerve, So this is the nerve that you hit with the funny bone. Comes right through here, down into your pinky, a little bit of your ring finger as well. Take your hands out in front of you. Make your index finger and your thumb meet. The other fingers are sticking straight out in front. And you're going to flip your wrists. So ultimately, you want to get the palm side of your hand onto your face. And it's a little bit tough. So if you've got a lot of muscle tension in your lats, it's going to be hard to do. So it's a good stretch there. You might feel it pull in your back, which isn't necessarily nerve, but more muscle tissue. Pull back, lift your elbows, and then down. Now, you might only be able to get to here. That's okay. So practice over time. That should start to get a little bit more mobile. And eventually, maybe you can get up here. It's okay if you can't. But it's a goal eventually. Okay, so we're going to talk next a little bit about the sciatic nerve. That's the bigger of the lower extremity nerves that will stretch. Most people have heard of it at some point. Most people have also had back pain, and it might have been incorporated into a routine, or you found them online. This one's a little bit important about how you perform. Well, they're all important with how you perform it to get optimal stretch, but this one in particular, I see done wrong lots. So what we're going to do, you want to find a chair where you can sit as far back as you can. If you're on a little stool, it might not be great because we need that chair to come as close to behind your knee as we can do. The reason for that is if our legs are dropping down too much, we're going to take some of the pressure off the nerve, and we want to make sure that we've got a good amount of stretch to it. This is a good one to do. It simulates driving. So if you're doing a lot of driving, this is a nice way to make sure that those nerves are gliding instead of just being in one stretched position for a long period of time. So with this exercise, you're going to sit as far back in the chair as you can. Bring your knees together. That's also really important. Knees together. You want to put your hands behind your back if you can. Slouch. You're going to bring your chin down to your chest and straighten one leg as much as you can straighten it, and then pull your foot back. You should feel a pull. Most people do. And then bring it down. You're going to slouch, curl your head, straighten your knee, pull your foot back, and then down. This is kind of a fun one to see. A lot of times it feels like muscle tension, and you might say that you have some tight hamstrings. But actually, if you're down here and you feel that tension here, if you lift your head up and then all of a sudden your leg feels better, a lot of times that's more nerve tension versus actually hamstring tension. And you can see if there's a difference between your driving leg and your non-driving leg. Okay. One of the exercises that we do here, we might have them do a set of 10, maybe slouched and just doing this. But you can also make it a little easier if that feels like it's too much. You can start slouched, but as your leg comes up, look up at the sky, and then down as your leg comes down. Up and down. We call this one kick your head off because it kind of looks like you're kicking your head off. That's more of a simple movement as well. So instead of taking the nerve and stretching it, it's gliding it, and that's just as healthy for it. Okay. We can vary it again based on symptoms that you may or may not have, and sometimes you might have more tension behind the knee or at the ankle, and we can further kind of divvy it up from there. But again, that's down, pull back, here, up, pull back, and down. And just every once in a while, check to make sure that your knees are still together, you're still scooched back in that chair as far as you can, so you're going to get the most out of it. Next, we've got a few on the floor, actually. So we're going to move this guy out of the way. Okay. The next few exercises we do, also for the sciatic nerve, but there's a couple different variations. So if you ever had like an Achilles tendonitis or shin splints, some of these might be good for you to do as well. A lot of times after the initial injury has subsided, you're left with some soft tissue restriction, or the nerves maybe can't glide as much, and they might continue to produce symptoms. But also, if you're a runner or you're becoming more active, just anything to keep those nerves moving will help prevent injury. So first, and they're relatively easy, we're going to lie down If you can straighten your other leg, great. If not, that tends to make more of a stretch. That's okay too. You're going to grab your leg, straighten your knee, and drive your heel up towards the ceiling. There might be a good enough stretch for you. This is pretty tight. Bring your foot back up and then down. You're going to drive that heel up towards the ceiling, so really push. It's one thing to just bring your leg up, but if you actually push up towards that ceiling, you're going to feel a much better stretch. Up and down. Okay, next what we're going to do is add a little bit of foot movement. We're going to push that foot up, and now we're going to turn your foot in. That's going to change the nerves a little bit. Down and relax. Up, push that heel up, point your foot inwards towards the other leg. Down and relax. Up. Okay, now to switch nerves, we're going to do the peroneal nerve now. So it comes right down along the outside of your leg. So maybe if you had a sprained ankle, this might be good for you. So this time, instead of pushing your heel up, you're going to straighten your leg up. You're going to point your foot and turn it in. So the heel's not leading the way anymore. The rest of the foot is. Up and in. Okay? So you can do 10 of those. You might feel it in your hamstrings as well. So next and last, lying on your back, up. This time you're going back to driving with your heel, but we're going to get the nerves on the inside of your foot. So push up, and then you're going to twist your foot out to the side, then back in and down. So foot up, out. It's a little trickier, I think, in and down, but you might feel that more along your inner thigh and the inside of your ankle as well. Up, out, in, down. Okay, so next, the femoral nerve is another big nerve. We want to lay on our stomach for this. We want to keep our hips down. We're going to get the best stretch that we can if this isn't a comfortable position for you, and sometimes it's not. You can omit this one, but there's other ways we can manage it in the clinic. So first, we're going to flip you over. Again, you want to be on your elbows. Okay, as long as that's comfortable for you. And we're going to bring your heel up. So there's not much to it. You're going to feel your quads stretch as well. Turn this way a little bit. And then down, up, and down. And often with this, you need a little bit more of a kick to it, a little more of a overpressure to stretch it. We're going to lift your head up, bring your heel towards your head, and then back down. Okay, again, if this is too much pressure, don't do it. Up and down. This is one of the stronger movements for the femoral nerve. Up and down. And if you need to make it easy, maybe it is difficult for you, you can do the opposite, and instead of pulling that nerve at both ends, you can slide it. So this was how we'll modify. You'll look down as you come up and up. So look down and up. Okay? You can do about 10 reps, and those kind of feel good just to get the hamstrings, or I'm sorry, the quads going as well. So I think that about concludes it for today. Thank you so much for joining us. If you have any questions, we'll be live answering questions. You can call the clinic, and we can certainly answer anything that you have. Thank you so much, and hope you stay safe and healthy and active. And please join us next time for our next CoFIT series. Take care.